All right. Well, thank you, Dr. Pesco, for your presentation. Again, thank you to all our speakers. I hope everyone's knowledge has been expanded by their talk. Now it's time for questions and answers. We're running a little bit late, but we'll be able to take at least two questions. All the questions, all unanswered questions, we're going to direct, if you email them to NAPAC at fdn.org. Yes, that's at it's info@napacfdn.org for unanswered questions, and we'll send them directly to you. So all speakers, please unmute yourself and turn on your camera. Okay, very good, thank you. So Dr. Coco from NAPAC will be reading the questions from the chat. A lot of the questions have already been answered, but we may have a few that we can answer live right now, and the rest will go to the email. So Dr. Coco, do you have the first question?
Let me, Dr. Ogumbe, can you start with the first question? I will, okay, I think we have one question. Is there a role of immunotherapy in advanced colorectal cancer? Is there a role of immunotherapy in advanced colorectal cancer? I'm assuming that they're probably talking about stage 4.
Right. So that question will probably best answered by Dr. Iwuji. Dr. Iwuji, can you take that question?
Yes, I'm happy to take that question. So yes, there is potentially a role for immunotherapy in colorectal cancer, particularly in stage 4, like you've alluded to. Now, it's not for all metastatic colorectal cancers. You have to have a specific kind of genetic mutation. That particular genetic mutation is called, it's basically called MSI high or MMR proficiency. Now, that is in the Caucasian population, you find it in about 5% of the population, maybe 5 to 10%, but it is estimated that in the Nigerian population, we can see that in about 25 to even 30% of our population, and they might be eligible for immunotherapy treatments, which has excellent results in that population.
Thank you. All right. Do you have another question, Dr. Coco?
Yes, one more question from our audience. It says, should the colon be removed if family history is negative, if the family history has a positive genetic test result, so they don't bother about screening? The question again is, should the colon be removed if the patient has a positive genetic test, family history with a positive genetic test? Should they bother about screening, or should they just remove the colon?
All right, very good. I think Dr. Ajumobi may be able to answer that question for us.
Oh, absolutely. The short answer is no. It's much more complicated than that. We have different types of genetic disorder, and the mode of inheritance is different. The penetrance of the disease, meaning if you have the disease, are you going to manifest if you have the gene, are you going to manifest the disease, is also different. So let me give you an example. In America, the lifetime risk of having colorectal cancer is about 4%. For patients with Lynch syndrome, it's over 50%, depending on the type of Lynch syndrome. And then for patients with familial adenomatous polyposis, it's over 90%. And so for those patients, without intervention, I'm talking about patients with FAP, most likely they're going to get colorectal cancer. So it depends on what type of genetic disorder. We want to start screening way earlier in this patient population. For patients with Lynch syndrome, we usually start around the age of 20 to 25. In patients with FAP, we usually start around the age of 10. And so it depends on the genetic disorder, but we don't have to prophylactically remove everyone's colon with a genetic disorder.
All right. Well, thank you. I think our time is up. Thank you, everyone, for attending today's webinar on colorectal cancer awareness. We want to thank NAPAC Foundation and all the partners, as well as all the presenters. On a final note, and to close this program, we're going to hear from NAPAC Foundation Board Chair, Dr. Niro Koko. The others, we can mute.
Thank you. I had a couple of questions that just came in. I think one for Dr. Fesco, and I think another one. But we're going to take all questions, and we will be posting this recording and the questions on our website, www.napacfdn.org. I mean, what a day. I wish we had more time so that we can even talk about this very, very impactful disease that, according to Dr. Lalode, when we were chatting earlier on, that should be in the dustbin right now, because there really should be no reason to have colorectal cancer. It's totally preventable, which is why we're having this conversation. But I want to just thank, our Health for Prosperity colorectal cancer awareness and prevention partners. FightColorectalCancer.org. It's a nonprofit. They have been really supportive. We're in their pin right now, and there's a lot of information that you can get after this. If you wanted to get more information or to share, you can visit their website, questdiagnostic.com. Of course, they offer the FIT test, which we've talked about, which is highly sensitive, really available and easy to use, and one of the next best things to the colonoscopy based on what we have heard. And I've also been informed that, for those that are in the United States that are qualified 45 years and over, this test can be ordered because it's covered under the Affordable Care Act, and a lot of the insurance companies also cover this test. So you can order this by speaking to your doctors, and some of the clinicians that are out here also in the United States can also kind of take the next step and just look at the patient demographics, and let's start to just at least provide the simple tests so we can start to screen for this at an early age. Thank you, Quest Diagnostic, Dr. Pesco, for coming in. We have Reddington Hospital represented by Dr. Lalode, who have now taken this to the next level in Nigeria, same as Duchess. Represented by Dr. Ogumbi, and Lakeshore Cancer Center, they're represented by Dr. Iwuji. I cannot thank you guys enough. And, collaboratively, I think, we can continue this fight and take it to the next level. How can I forget, those that have really made this today, happen? Want to thank Yeti from the bottom of my heart for just being brave enough and bold enough and really nice enough to share your personal story. This is the first time that I'm going to see this kind of, emotional story being displayed out there, and it shows your commitment to really wanting to eradicate this disease and not letting the same thing that happened to you happen to anyone else. Thank you, Dr. Ceci Ogumbi. A wonderful audience across the world. I see people from Enugu to, United States to all over the world, Ireland, and all kinds from all over the world that have joined in this. Fighting colorectal cancer is a global war, and it's a war that I believe we can win. I want to thank all our panelists. I've mentioned their name. I want to thank the global NAPAC family that have, kind of made this possible and put us in this position to be able to start impacting, our communities and starting to bridge the gaps in health disparities through this program. I want to thank the NAPAC Foundation Board and executives, and of course our Health for Prosperity team, most of who presented today, and our team of volunteers that donated time and effort to prepare and make this happen, and of course our donors. So you'll indulge me for a minute as I go. I'm going to go offline and then just kind of hide my camera, not because of anything nefarious, but just because I would like for some minutes to get your attention. There's nothing wrong with the presentation or your screen. I just want us to be able to process everything that was kind of talked about, take it in, and really think about, what are we going to do with this information? Like Yeti, some of us have personal stories of colorectal cancer. Our family actually just suffered another loss to this disease yesterday. May our soul rest in peace. And we don't want any more colorectal cancer because we know it is preventable. Those of you that are familiar with who I'm talking about will probably know the story or hear about it later. We have learned about colorectal cancer from all our doctors. They've told us about the age, the risk factors, the causes, the treatment, and the testing, and how easy it is to test for this. The non-invasive FIT test that Dr. Fesco just wrapped up about. And they've all done their job, and they've done a very good job. So I thank them. But the question is, if you've watched this webinar and you fall within that age group, have you been screened? If you haven't, what are you going to do after hearing this message? Who are you going to share this message with? How would you ensure your loved ones, people around you, get screened, including yourself first? The aim of this webinar, when we planned it around March, being Colorectal Awareness Month, is not just to bring awareness. Awareness without prevention is just a futile effort. Our aim is to start a fight against colorectal cancer, a disease that we know is preventable. Like Dr. Wallace said, if we catch it at the early stages. So I ask you, I beg of you to spread this message. Get screened. Fight colorectal cancer within yourself and your family and friends. And let's save a life. This is going to be an annual event, so we want you to join us next year to share some positive stories. I, for instance, would like to hear a story about someone that was on here, or would see this video and share it, and by so doing, save their life or the life of somebody that they share the message to. Like the COVID pandemic has shown us, not all superheroes wear capes. Recently, we found out a lot of the doctors and healthcare providers are superheroes as well, as they stood up and fought COVID. We can fight colorectal cancer the same. And you can be part of that team. You can be a superhero. And all you need to do is just spread this message, encourage your loved ones to go get screened, and let's start fighting colorectal cancer. There's so many ways you can join in this fight. It's totally unnecessary to have this, but I want you to join us in this army as we fight this. Join our team, join our partners, Quest Diagnostic, Fight Colorectal Cancer, Reddington, Lakeshore, and all the other partners we have. And if you want to do more than just spread the message, you can also fight colorectal cancer by donating to NAPAC Foundation. You can do that in 3 easy ways. You can scan the QR code that's right on your screen anywhere in the world and follow the instructions. If you're in the United States, you can text the word lifesaver to 818-290-8858. The word lifesaver to 818-290-8858. And you can follow the instructions there. Or you can visit us at any point, at any time, at www.napacfdn.org. And we'll be posting this message there. And we're hoping that you share this and probably, verbally share it. And also you can share the videos. And we'll also be posting the responses to your questions also online. This is a war. This is a fight that we can win. And I'm hoping that after listening today, you'll become part of the team that's going to eradicate this, but starting with yourself first. Get screened, follow the instructions from your doctor so that we share positive stories next year and not another story of another avoidable death. I wish I was one day early for the person we lost yesterday. I don't wish the same to you or your family. I pray that you all have a good, healthy rest of your day. I thank you for listening, and I wish you well. Thank you all, and have a good rest of your weekend. Thank you for joining. On behalf of NAPAC family, I wish you all well. Thank you, and bye.